Good evening, everyone. Welcome to this webinar hosted by the AVP Research Foundation. Um, Myself, Dr. Uma. I'm Assistant Research Officer at AVP Research Foundation, and I'm physician at the Gotra Specialty Clinics, which is the gynecology and obstetrics clinic under the AVPRF Specialty Clinics. So today in this episode, I'm here to discuss about the topic Panchakarma for gynecological disorders. Okay? Healing from within. So we all have heard about the word Panchakarma, and it's a very common term nowadays, but we are not aware about what it is and what is its relevance in health, okay, in maintaining our health, okay, in treating diseases, etc. So today in this webinar, we are going to see about this topic called as Panchakarma. Okay, it is a classical detoxification treatment and rejuvenation therapies, and it offer deep healing for women facing gynecological disorders and infertility. So, rooted in centuries of tradition and refined through clinical experience, Panchakarma not only addresses the symptoms but also the root causes, restoring balance at the physical, mental, and the emotional levels. So, this presentation will show you how these therapies support the reproductive health, enhance the fertility, and promote the overall well being in women. And this presentation is mainly for the general public to understand the concepts of Panchakarma, what is Panchakarma, and how it is helpful in the gynecological disorders. So, before we begin, let me give you a quick review of what we will be covering in this session. We'll start with a brief introduction to Panchakarma and why it is such a vital part of holistic health, especially in women. Next, we'll go over some common gynecological disorders that women face today, from menstrual imbalance, menstrual irregularities, infertility, etc. And then we'll see how these Panchakarma therapies are applied specifically in women's health, with a focus on the therapies like Utavasti, Vasti, Virechana, etc. Okay. So the first will be an introduction to Panchakarma. So we all have heard about this word Panchakarma, and Panchakarma is a comprehensive detox treatment aimed at cleansing the body of the accumulated toxins. Okay, also called as ama. Okay, and Panchakarma works by balancing the doshas. Doshas means they are the fundamental functional units in the body, and the doshas are three in number. They are Vata, Pitta, and Kapha. So to bring the balance of these doshas in the body is considered as a healthy state. And this Panchakarma helps to bring this balance of the doshas and in restoring the natural rhythm of the body. And Panchakarma is commonly used to treat various conditions, gynecological conditions, especially like menstrual disorders, infertility, hormonal imbalances, and many other diseases. Okay. So, what is Panchakarma? Panchakarma is a detoxification and rejuvenation process in Ayurveda, and it is designed to mainly eliminate the toxins or the ama, restore the balance in the three doshas, they are the Vata, Pitta, Kapha, and also to rejuvenate the body, mind, and spirit. If you see in Ayurveda, true health means samadosha, samagnisha, samadhatu, malakriyaha, prasannatmendriyamanaha, swastha ityabhidiyate. Means the balanced doshas, okay, the balance of the three doshas, the Vata, Pitta, Kapha. Sama Agni means balanced Agni or a good digestion, balance of the digestive fire. Okay, Agni means the digestive fire, which helps in the process of digestion. And Samadhatu means the balance of the tissues in the body. There are 7 tissues called as dhatus in the body, and the balance of these dhatus. And Malakriya means the elimination of the wastes. Okay, proper elimination of waste also has to happen. And Prasannatmendriyamana means a joyful soul, senses, and mind. So all these put together is considered as a healthy state. Okay, the balance of the doshas, a good digestion, balance of the dhatus, the proper elimination of the wastes, and a joyful soul, senses, and mind. So all these together is a healthy state. So here, if you see, Panchakarma is the detoxification and rejuvenation process, and it helps to remove the toxins. Otherwise, it can be called as ama, okay, from the tissues or the dhatus or the channels in the body. And it restores the strength of the digestive fire or the Agni. And in the second point, you can see it balances the three doshas, the Vata, Pitta, and Kapha. Okay, so usually any disease happens when there is a derangement in the three doshas. When the three dosha loses its balance, then it leads to any diseases in the body. Okay, so when these doshas are excessively aggravated to a state where the body is unable to bring it to balance just by medicines. In that case, we have to remove these doshas out of the body or eliminate these doshas out of the body. And at this stage, we use the Panchakarma procedures to remove these doshas out of the body, or it is called as detoxification procedure or detoxification treatment. So by balancing these three doshas, okay, even any disease in the body is because of the irregularities or disturbances in these three doshas. Even the gynecological disorders, any disorders in the body is by an imbalance of the three doshas. So when they are brought to balance, the diseases can be managed or reduced or cured. Okay, it also improves the energy in the body, improves the immunity and the reproductive strength. And in the third point, you can see Panchakarma also helps in the mental level, in calming the mind. It clears the toxins such as stress, worry, anxiety, etc. And it rebalances the neurohormonal pathways affecting the menstruation and fertility, and promotes deep relaxation, mental clarity, and emotional stability. So here in this slide gives you a snapshot of the 5 main therapies under Panchakarma, each targeting different doshas and organs systems. In the center, you can see the term Panchakarma therapy, which literally means 5 actions or 5 treatments. So these are the fundamental detox procedures in Ayurveda. Okay, so let me quickly go through these through each. Okay, Vamana, you can see in the table, Vamana is the therapeutic emesis. Okay, vomiting emesis procedure, mainly used to expel the Kapha dosha from the body. So this is useful to eliminate the excess Kapha which is accumulated in the body. Okay, and that is called as Vamana, which is therapeutic emesis. The next is Virechana, which is the purgation therapy. It is therapeutic purgation therapy that clears the pitta from the body. So among the 3 doshas, Vamana is used to clear the Kapha, excessively aggravated Kapha. Virechana is used to eliminate the excessively aggravated pitta from the body. Okay, and it is useful in many gynecological conditions as well. And the next is Vasti. Okay, Vasti is medicated enema, which is considered the most important for the gynecological and fertility issues. Okay, it helps to regulate the Vata and governs the reproductive system, reproductive functions, and also it nourishes the uterus. So Vasti is mainly for the Vata dosha. Okay, Vata dosha. And the next is Nasya. Nasya is administration of medicines through the nose in the form of oil, ghee, or any decoctions, liquids, etc. And this therapy is good for relieving the doshas from the head region. And also it is good for hormonal imbalances, stress, and also it helps to improve the mental clarity, etc. And then lastly, Rakta Mokshana or bloodletting. Bloodletting is an important therapy in Ayurveda, which is often used in Pitta-related disorders and also disorders related to the blood. Okay, here the blood, which is removed from the body. Okay, the blood is removed from the body through this process called as rakta mokshana or bloodletting. Okay, and it is also good in also in skin issues, skin disorders, and in certain uterine conditions. So here you can see the common benefits of Panchakarma. We know that Panchakarma are 5 treatment procedures, and in common, you can see the benefits in gynecological disorders are they remove the toxins affecting the fertility, hormones, and menstruation. Okay, and also it prepares the womb or the uterus for conception, because a healthy uterus is essential for a healthy conception and growth and delivery of the baby. So it prepares the womb for conception. It enhances the fertility, enhances the ovulation. Okay, only when all these factors are good, only then a proper conception can happen. So it enhances ovulation, endometrial health, and also implantation of the baby in the womb. And also it treats conditions like PCOS, fibroids, endometriosis, as well as infertility. So now we'll see certain gynecological disorders that are commonly managed through Panchakarma therapy. So let's go through them briefly. PCOD or PCOS, which is a common term nowadays. It is increasingly common and linked with hormonal imbalances and impaired digestion. So this is the problem with the ovulation. The release of the eggs from the ovaries doesn't happen, or it gets delayed. This brings irregular periods, Vata and Kapha type of disorder. PCOS is a Vata and Kapha type of disorder, and Panchakarma helps to regulate the hormones and improve the metabolic function in this case. The next one is dysmenorrhea, or it is called as painful periods. It is again often due to the aggravated Vata. And the next one is amenorrhea, means the absence of menstruation, and it can happen from both Vata and Kapha disturbances. And again, here Panchakarma helps to restore the cycle and bring the balance of these doshas. And the next one is menorrhagia or heavy bleeding. Okay, often it involves excess pitta dosha. Okay, heavy bleeding usually happens with excess pitta and rata, and here rata is blood. Okay, and here virechana or recta mokshana can be beneficial. And again, endometriosis and also fibroids, okay, have a deeper involvement of the ama and doshas and dhatu imbalances. And here also Panchakarma can be done. And infertility is another major area where Panchakarma is useful, and it's extremely effective in clearing the reproductive channels and supporting the conception. So there are many reasons which leads to infertility, and in each condition, according to the dosha, according to the dhatu involvement, the suitable treatments are chosen. So each disorder requires a customized approach, but Panchakarma forms a strong foundation for long-term healing and balance. Now we'll see the table, which gives a concise overview of how each of the Panchakarma therapies is used in treating these gynecological conditions. So first, we know Vamana, which is the therapeutic emesis. Okay, Vamana involves induced vomiting to eliminate the excess kapha from the body, particularly from the upper respiratory system and the digestive tract. So here, kapha can lead to sluggish metabolism and weight gain, both of which contribute to the hormonal disturbances and also PCOD and obesity in women. Okay, so here in PCOS, we can see that it helps to clear the excess mucus and toxins out of the body, and associated hormonal imbalances also can be cured, and it helps to improve the ovulation process, which will be impaired in the PCOS condition. Okay, and it's also by the removal of Kabha with the help of Vamana, it also helps to clear the excess fat accumulation in the body, supporting weight management. So it is good in obesity also, and also in hormonal imbalances. By balancing the Vata, Vamana helps to regulate the hormones and the menstrual cycles, which can improve the overall reproductive health. And the next is Virechana. Virechana is purgation. Virechana, here it involves the purging the toxins from the body through the gastrointestinal tract, and it focuses on eliminating the excess pitta dosha, particularly from the liver and the digestive system, etc., from all over the body in general. Okay, so here it is used in many female gynecological issues, like in excess bleeding, okay, and but to reduce the pitta, okay, in fibroids, in polyps, okay. Here, by it balances the pitta dosha, and it also regulates the vata, downward flow of vata, and this Virechana has a scraping property and reducing property, which helps to reduce the size of these fibroids or polyps, etc. And also in tubal blocks. Whenever there is a block in the fallopian tubes, again, Virechana will help to remove those blocks. And in infertility, it helps to cleanse the body of the toxins and the doshas that may be affecting the reproductive system and improving the fertility. Okay. And again, the next one is the Vasti. Vasti, Vata is imbalances often lead to the reproductive challenges in women, such as irregular periods, infertility, etc. So Vasti is the most important therapy for the Vata disorders. It involves the use of medicated enemas to clean the colon, regulate the Vata, and nourish the body. So Vata is the main treatment for, Vasti is the main treatment for the Vata disorders. Okay, and it regulates the menstrual cycle. So the menstrual cycle is mainly governed by the Vata dosha, and Vasti can regulate the Vata, which is often responsible for the irregular periods, okay, and painful menstruation, etc. When usually when there is painful menstruation, we can understand that the Vata dosha is involved. Here, Vasti is a very good treatment which balances the Vata, and you can be relieved of your painful menstruation, etc. And ovulation also, when there is an ovulatory cycles, okay, in PCOD, ovulation doesn't happen properly. In those cases also, Vasti is Vasti is very helpful. There are different types of Vasti. Okay, so according to the condition of the person, according to their basic constitution, you can choose the different types of Vastis. Okay, and again, infertility also, it nourishes the reproductive organs and improves the uterine lining. Okay, uterine endometrial lining, and increases the chances of conception. Sorry. So the next is Nasya. Nasya involves the administration of oils or powders or ghee through the nose. And it clears the toxins from the head and sinus and in the brain region. And Nasya helps to manage the mood swings, anxiety, and stress, which are commonly experienced by women. So by stimulating the hypothalamus pituitary axis, Nasya will help to regulate the hormones like FSH, LH, TSH, etc., making it effective in managing menstrual irregularities, in infertility, in premenstrual syndromes, menopausal symptoms, stress-related hormone imbalance, in other women gynecological issues, etc. And it helps to remove the accumulated toxins in the body, and also to bring the hormonal balance. And the last one is Rakta Mokshana. It involves purifying the blood by removing the toxins and excess heat through controlled bloodletting therapy. So by purifying the blood, it can help to reduce the internal heat and inflammation associated with endometriosis, fibroids. Okay, so blood stagnation can lead to various disorders in the body like fibroids, etc. So by bloodletting, it will help to reduce the overall inflammation and other blood-related disorders. So next we'll go to the treatments, other treatments related to Panchakarma, and they are Snehana, Svedana, etc. Snehana, again, it is externally as well as internally. Snehana refers to the therapy of oleation or use of oils, ghee, etc., which helps to bring unctuousness in the body. Okay, so Snehana can be external. Now we are saying about the external Snehana, where application of warm medicated oils in the body Okay, it can be in the form of massage or pouring of oil all over the body called as spiritual. Okay, so that there are different types of snehana procedures, and they help in the detoxification of the body, and they are also used as a preparatory therapy before the Panchakarma treatments. Okay, and next one is Svedana. Svedana therapy is sudation or sweating therapy, and they usually follow the Snehana therapy soon after the Snehana therapy. And this Vedana helps to again open up the channels and release the toxins out of the body, and it helps to enhance the effects of oiling by loosening and mobilizing the toxins from the tissues. Again, Snehana is also a pre-Panchakarma therapy, and Snehana and Svedana are integral components of the Ayurveda treatments. They are aimed at detoxifying the body and restoring the balance. So both the therapies work together, and Snehana does nourishing and softening of the tissues, while Svedana eliminates the toxins and ease the muscle tension. So together, they are highly effective in treating gynecological issues like PCOS, infertility, menstrual cramps, fibroids, etc. And the next one is Snehapana. It is the internal intake of the Sneha or the ghee or oil. Okay, so it involves the consumption of the medicated ghee or oil. So it is primarily used as detoxification technique to balance the doshas, to improve digestion and prepare the body for the detox treatments called as Panchakarma. So it is essential part of Ayurveda approach, the Panchakarma treatment, and it is very good in treating infertility, okay, in strengthening the uterus and in preconception care. Even when the couple, even they are healthy, taking a Snehapana and any one of the Panchakarma treatments before conception would help to remove the toxins from the system and prepare the womb for a healthy conception. Okay, and during pregnancy also, it helps to ensure the proper growth and development of the fetus. The next treatment is Yoni Pichu. It is the use of suppository, a sterile cotton swab you can see in the picture, or a tampon. It's usually a cotton swab which is soaked in medicated oil or ghee, is inserted into the vaginal canal. Okay, and it is left there for a specific period of time. Okay, it enhances fertility and uterine health. Okay, and it also moisturizes and rejuvenates the vaginal mucosa. And even during the last trimester of pregnancy, it helps to strengthen the birth canal and provides lubrication for an easy delivery. It is also good in infertility, in any infections in the vaginal region or in the uterus, etc. It also supports the uterine muscles. It is a in the uterine tone, hormonal balance also. Okay. Next one is Yoni Dhavana, where it's a herbal cleansing procedure in the vaginal area where herbal decoctions are used for the cleansing. And again, here also it is good in infertility, in any infections. Okay, it balances the vata and pitta dosha of the reproductive system, in vaginal dryness, in infertility, in postpartum recovery, okay, in white discharge. Okay, in also in the last trimester of the pregnancy, it can be used, and also helps to maintain the pH of the vagina and microflora, and it's good in inflammation, in burning sensation, etc. The next one is Utavasti or intrauterine oil enema. Here, the medicine, the oil is gently introduced into the vaginal canal, directly into the uterus, through the vaginal canal into the uterus. So, Utavasti is a very important procedure for the therapy for the uterus and the reproductive health. It is a very good treatment for infertility, in fibroids, okay, in any PCOS, okay, in tubal blocks, fallopian tube blocks, in endometriosis, and it helps to balance the vata and also prepare the womb for the conception. And the next one is Abhyanga. Abhyanga is the practice of application of warm medicated oil all over the body. And it is again helps to improve the circulation, in detoxification and relaxing the body. Okay. And here you can see it nourishes the reproductive organs. It brings the balance of the dosha, the vata dosha especially. And even at the time of pregnancy, women can do this abhyanga to bring a balance of their vata dosha and to bring looseness and strengthen the joints okay, and which helps in the easy delivery. And even after the delivery, in postpartum recovery, it helps to tone the and rejuvenate the body and balance the Vata dosha after the childbirth. Next one is Udartana, which is the powder massage, which is again the use of powders for massaging all over the body, and it helps mainly in weight loss. Okay, weight loss to balance the Kabha dosha, to scrape off the excess fat from the body. It is good in PCOD and also in fluid retention, etc. The next one is Shirrohara. Shirrohara is the pouring of medicated oil or herbal decoction continuously in the forehead in a steady stream. Okay, it is mainly used to relieve stress and anxiety. Okay, stress and anxiety to balance the Vata dosha and Pitta dosha in sleep disorders, to support the hormonal health. Okay, it boosts the fertility. Okay, it improves the ovulation in women, and also in postpartum after delivery, it helps to calm your mind from stress, and also to get a good sleep. So thank you for your time and attention today. We have covered how Ayurvedic therapies, particularly Panchakarma, can play a transformative role in supporting the gynecological health, improving fertility, and addressing conditions like PCOS, fibroids, etc. So by restoring balance of the doshas, detoxifying the body, and rejuvenating the reproductive system, these therapies offer a holistic approach to women's health and well-being. Thank you.